You hurt your low back. You don't know what it is. Well, don't self-diagnose. Why don't you go to a doctor, a chiropractor, physical therapist, or another type of doctor before you do any of these exercises? Because I'm not going to diagnose you on Instagram. I don't know what's going on with you. But if you found out that you have a muscle strain, which is tearing in the muscle fibers, or let's call it a pulled muscle, or they're torn to a greater degree than when, say, you work out, and it's an injury. And so what you want to do is, well, you don't want to stretch them excessively, right? Well, that will cause more pain, and it's kind of hard to use them, right? Because if the muscle contracts, it has to pull tight, and if it's torn, it's going to scream at you. So what can you even do? You know, aside from rest, ice, compress, elevate, classic recommendations, anti-inflammatory, stuff like that. Hopefully through food, anti-inflammatories, extra virgin olive oil, fatty fish, avocado, nuts and seeds, things of that nature, leafy greens, berries. But aside from that, with exercises, the rule of thumb is you want to get yourself moving in planes that are not very painful. If it's slightly uncomfortable, that's okay, but if you feel that sharp pull, that pain, stop it, discontinue for sure, all right? So what we got is some knee sways first. Knee sways. So you're like this. You can just rest your head, sway the knees to the side, nice and slow. Right? You don't want a lot of speed here. You don't want rapid movement. You know why? Well, you don't want to be jerking around in general, right? Especially if you have torn muscle fibers, and if you jerk, right, I mean, you can tear them worse. Or if you're not going to even tear them worse, you're going to get to that point where you had sharp pain, and you wouldn't realize until you got past a point in the range of motion you never would have got to had you just gone slow. Because maybe I feel it here, all right, I'll stop, right? But if this feels okay, do some knee sways. All right, next one is knee to chest. So you just pull the knee to the chest. Nice little stretch. Pull the knee to the chest. That's great. While you're laying here, take the feet and plant them. And these are good exercises in general for your low back. This is more specific to a low back muscle strain, right? But what we're going to do here is we're going to deactivate the low back by activating our abdominal muscles. And the way we're going to do that is very simple. We're just going to press our low back down into the ground and squeeze the core. Press your low back down into the ground and squeeze your core. Now, if you can, you could also do a glute bridge. You could push up. But look, you want to make sure you're not arching that low back. You're not using that low back. You're using all glutes, pushing through your feet, right? Majorly the heels, and squeezing the butt. If it's painful at all, don't do that one. That one might take a few days for you to be able to do, or even weeks. Who knows? It depends on your unique case, right? So then, you're going to turn on over, and we got two more here. We got cat, cow. We got a cat-cow, right? So boom, arching the low back, rounding the back. Arching the back, rounding the back. That's our cat-cow. And the last one is child's pose. And you're just going to lean back, let your toes on the ground, lean back, put that butt back, and then reach forward and get a nice stretch in your lats and through your low back. Now, what's one other thing you would definitely want to do as soon as you can? Walk, right? Let's get some blood flow to the muscles. Let's help them heal a little bit quicker. It's good to deliver oxygen and nutrients to help everything repair. So as soon as you can walk, that would be great. And if it's painful for you to walk, well then don't walk yet, right? But you want to get moving as quickly as possible. You don't want to just sit there and lay down. Unless you're in so much pain you absolutely can't move, try some of these exercises. If you absolutely can't do anything, just rest, right? Lay down, rest. You could put a pillow under your knees, you lay on your back. It'll take some stress off your low back. It'll put some slack in your spinal cord. You could even pop a pillow under your low back as well if you wanted to. So low back and the knees is a pillow under, right? Laying on your back, less stress. That's if it's really bad, right? But you got to get a lot of rest and a lot of nutrition and hydration as well. So that's what we got for you guys. Hope you found it informative. Hope it was quick and we got to the point. Who do we got here? Say what's up to everybody. That can be hard sometimes because we have so much fun out here. Want to keep on talking, hanging out. Friday night, baby. Lucas, I love you, man. What's up? Taylor, how you doing? Das, Usator, Shoulders, There's a lot of things you can do. I did a video on that recently. Moonbo, you buy pizza, all right. Friday night, pizza night. Good for you. You know, I get a good workout tomorrow, you know. At least get some carbs in, you put them to good use. Sibia, how you doing? Don't feel bad about eating it either way. It's okay. And I am Carly. Thanks for hopping on, guys. Thanks for the support. As for now, so we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great rest of your night. Thank you very much. Happy One Wellness. See ya.